Other uses of anti-epileptic drugs. Anti-epileptic drugs. Introduction. Due to the increase in anti-epileptic drugs, many researchers and scientists began to utilize new uses for it other than epilepsy, which is divided into two main categories. First, psychiatric disorders. Second, chronic pain. Pharmacodynamic mechanisms of AED action. Main effect on ion channels like on sodium channels as the refractory period reduce occurrence of high-frequency firing, prolonging it further by drug therapy could reduce the possibility of seizure activity like carbamazepine and phenytoin. Used on calcium channels as it works as T-type calcium channels found on cell bodies and dendrites, also on N and P/Q voltage-sensitive calcium channels located on presynaptic nerve terminals. It binds to T-type calcium channels in thalamic neurons and prevents oscillatory firing characteristic of absence seizures. Gabapentin and pregabalin bind to a composite protein unit associated with N and P/Q calcium channels known as the alpha-2 delta protein, which inhibits calcium entry and subsequent neurotransmitter release. Management of pain. 1. Neuropathic pain occurred as a result of neurons injury that results in abnormal sensitivity to noxious stimuli and innocuous stimuli. First, diabetic neuropathy. As gabapentin and pregabalin are having great effect on controlling diabetic neuropathy-related pain. Secondly, HIV neuropathy. Also, gabapentin could be used in treating pain while pregabalin show effect, but it's also like the placebo. Trigeminal neuralgia. Carbamazepine is the drug of choice for it, while valproic acid or lamotrigine could also be used. Prophylaxis of migraine. It involves cortical hyperexcitability concurrent with vasodilatation, inflammation, and altered pain sensitivity, as it is known that glutamatergic hyperexcitability overwhelms GABAergic inhibition, so valproic acid and topiramate had shown great effect on treating it. Uses in neuromuscular disorder. Essential tremors. Like rhythmical, involuntary oscillatory movements caused by alternative contraction of opposing muscle groups as a dysfunction of GABAergic neurons, primidone precursor of phenobarbital had shown efficacy in treating such tremors. Restless leg syndrome, RLS. Sensorimotor neurological condition that reduces sleep quality and quantity. Carbamazepine, gabapentin, and oxacarbazepine had shown great efficacy on treating the symptoms. Psychiatric indications. Bipolar affective disorder. Patients suffering from this disorder combine between both overexcitability, mania, and low mood named as depression. So in this case, a drug that could compensate between the two symptoms should be taken. In treatment of acute mania, valproic acid, carbamazepine are used as mood stabilizers due to their multiple site of actions. Also, lamotrigine show little efficacy in treatment of mania and also in prevention of depression. Anxiety. Anxiety disorder is the condition of excessive fear resulting from overstimulation of the amygdala. Drugs like topiramate, vigabatrin, and levetiracetam have anxiolytic effects. Also, gabapentin showed high efficacy in treatment of social phobia and with tiagabine used in generalized anxiety disorder. Insomnia. AEDs show effects on sleep architectures, so it could be used on daytime state of alertness. Tiagabine have shown high efficacy in management of insomnia, especially when taken at night. Schizophrenia. As in this case, brain dopamine transmission is amplified and a deflect in GABA receptor function. it is thought that AIDS could improve the symptoms of resistant patients to anti-schizophrenia drugs. Valproic acid, carbamazepine, lamotrigine, and topiramate could be used, but further studies should be made before applying it. Other uses: cancer. Tumor cells overproliferation has been a focus of cancer research for many years. One of the described mechanisms involves histone proteins within the chromatin of the cell nucleus of the enzyme HDAC have been investigated for anti-cancer activity. Valproic acid is a known HDAC inhibitor, which has shown in vitro activity against breast, endometrial and prostate cancer. It has also been proposed for the treatment of acute myeloid leukemia via reactivation of dormant tumor suppressor genes. Several studies are currently underway to assess its utility in combination treatment for AML, breast cancer, melanoma, glioblastoma, and non-small cell lung cancer. Asthma. AIDS could be effective in the treatment of bronchial asthma, as it was reported efficacy of carbamazepine and valproic acid in an open-label trial, with complete resolution of asthma symptoms, but it's still under study. Conclusion: in addition to the great effect of AIDS in the epilepsy, scientists found that it have great effect on other diseases and in releasing pain and in many other psychotic and physical diseases, and still under study, so need more study with large numbers of patients to show its full effect. Bola Ebrahim, Eslam Gamil Zaki, Ebrahim Amir, Tarek Awad, Mohammed Hamdi, Mohammed Said.